Good morning. My name is Suresh Vedantam, and I am an interventional radiologist and thrombosis researcher at Washington University in St. Louis. On this episode of Clot Chronicles, I will be discussing the treatment of chronic deep vein thrombosis and post-thrombotic syndrome. I'll be specifically focusing on an important ongoing clinical trial called the CTRAC trial, which is sponsored by the National Institutes of Health and is being conducted in 30 centers around the country. Many patients with deep vein thrombosis develop post-thrombotic syndrome, which most commonly causes leg pain, swelling, and can progress to developing skin changes and venous ulcers in some people. Maybe about 20% of patients who have had a proximal DVT ultimately develop a form of post-thrombotic syndrome that causes substantial life impact in terms of their ability to be active, their ability to work, or their health-related quality of life. Many of these people have an obstruction of the iliac vein, either from residual clot or from pre-existing stenosis or narrowing of the vein. For many years, physicians have been using stents to open those veins up, and we think that we've seen some degree of symptom improvement in the people who have been stented over time. However, there are no high-quality studies that have really evaluated the long-term benefit to risk ratio for patients who have undergone stent placement in this clinical context. So the CTRAC trial is designed to determine if stent placement for people who have post-thrombotic syndrome and iliac vein obstruction resulted in an improvement in the severity of post-thrombotic syndrome and an improved quality of life. For this study, we are seeking patients who are adults and who have had a DVT more than 3 months previously and who have post-thrombotic syndrome with evidence of substantial life impact and who have some degree of iliac vein obstruction demonstrated on an imaging study. Patients will be randomized to receive or not receive endovascular therapy with stent placement. All the patients in both treatment arms will receive quality medical therapy, which may include venoactive medications to reduce inflammation, compression therapies, and those who have venous ulcers will be managed in a professional venous ulcer clinic. Patients will be followed for 2 years, and we're evaluating the effect upon the reduction in post-thrombotic syndrome severity using clinical measures known as the Venous Clinical Severity Score and the Villalta scale. We're also using health-related quality of life measures. We're looking at venous ulcer healing, safety, as well as a detailed cost-effectiveness study. Participation in this study is a terrific opportunity for patients, so I hope that you'll consider it for yours. They get to join a program of structured, closely monitored care for post-thrombotic syndrome, where the study teams communicate with them and their providers effectively. The people in the study, the physicians, really are experts in post-thrombotic syndrome care and are dedicated to helping people with their symptoms with this condition. And irrespective of whether or not people are in the stent arm, there will be active efforts to improve symptoms in all patients in the study. All the patients receive free elastic compression stockings and wraps if they need them. They receive 2 free ultrasound exams, and in some centers, they also get free follow-up care and visits. This is an opportunity to receive stent placement in a closely monitored setting with independent safety oversight. And even for the people who aren't randomized to receive stents, if they prove to be effective down the road in the study, then they can always get stented later on, again, with the greater confidence from the study's results. From a physician's viewpoint, we think this is a great opportunity as well because these people are very difficult to manage at times. We're an experienced research group and we communicate very effectively with providers, and we're adopting many practices in the study that enable remote conduct in the context of the COVID pandemic right now. So to help this important study, we hope that you'll refer your patients. There are different ways to go about that. You can go to the CTRAC study website as well for more information. You can contact me directly. And please help us spread the word to other physician groups as well. We really want to make sure that the study succeeds so that people get evidence-based treatment. Thank you very much.